I am speaking with our State Senator Bruce Tarr. Good afternoon, Bruce. How are you?
I'm doing well, Heather. Good afternoon. It's wonderful to see that sunlight streaming through those windows on Cape Ann, and it looks like a beautiful afternoon there, and it's fairly bright here on Beacon Hill today.
So, you wanted to start by talking about reopenings.
I do. The pace of reopening is actually moving fairly quickly, and today, as we speak, today is April 30th, and again, I'm not sure when our viewers will get to see this, but some things that are happening that are very significant, and one of them is a change to the mask order that we have in Massachusetts. And as of today, masks are not going to be required outside where social distancing is possible. And so that's a major change that I think is a very positive change that's happening. And it reflects continuing progress with regard to reducing cases of COVID-19, reducing hospitalizations, and reducing deaths. And so the benefit of that is the governor is able to make some pretty important changes to ease these restrictions. Now, masks are still going to be required in public spaces and venues. So when people are gathered together, we're still going to need to have masks, particularly, for instance, if we're in a restaurant, but obviously we take the mask off to eat. So those things will remain in place. But what is changing is we're starting to see that we won't need to have a mask on necessarily everywhere. And I know for many, many people that will be welcome news. And then May 10th, which is coming up, we're going to have a reopening as we go into phase 4, step 2. And that means that amusement parks and theme parks and outdoor water parks will be able to open, but only at 50% capacity. But that's a pretty significant change. And then something else that I know a lot of people have been interested in are things like road races and other kinds of professional and amateur group athletic events. And those are going to be allowed, but with staggering, so that, for instance, if we have a road race, we wouldn't have the traditional scene of having everyone cross the starting line at once. They'd have to be staggered. And when folks do that, the organizers of the events are going to have to submit safety plans to the Department of Public Health. But the point is, these are things that we haven't been able to do in what seems like a very, very long time. I mean, we'd essentially lost a year of being able to do this. And on Cape Ann, these are such prominent things in the summer. And so we've missed them. And we are going to start to see some of them be possible. And then something that had been happening, but is now changing, again, I think for the better, and I think most people would agree, if not everyone, that beginning also on May 10th, indoor and outdoor stadiums, arenas, and ballparks, which are currently open, but only at 12% capacity, will be able to more than double that to 25% capacity. So again, not a total elimination of restrictions, but a significant expansion of ability to do things. And here's something, Heather, that was interesting to a lot of people, but won't affect me. And that is on May 10th, singing will be permitted indoors with strict distancing requirements. Nobody wants to hear me sing. And distancing is never a problem when I sing because everyone tries to get as far away as they can. But for those that are good at it, there will be the ability to do that. And again, there are some specific guidelines for the performance venues. But again, something that, we often used to take for granted in our lives, but now it hasn't been possible. Now it's going to be possible. So we're moving in the right direction, a lot of positive changes. Obviously, things can still change if we start to see the trends go in the wrong direction. But, as we see the sunlight streaming through the windows behind you and we think about spring on Cape Ann, we see that the restrictions are opening up to match that timing. So it's a pretty positive day as we talk about all of that.
It is. It feels really hopeful. Is there any conversation on Beacon Hill and maybe specifically in the governor's office about vaccination mandates? I had seen that something.
There has been some discussion of that in a couple of different ways. So there has been a discussion of a so-called vaccine passport, which has been pretty widely rejected as an idea on Beacon Hill at this point, and I don't think we'll see it resurface. There's been some discussion of mandatory vaccinations for public employees, and a lot of that discussion originated in the Attorney General's office, and there really hasn't been much more than that suggestion that all public employees should be required to have a vaccination. When you get into that area, you get into some very sensitive issues relative to personal freedom and things like the Fourth Amendment and being able to, violate somebody's personal space or intrude into it in terms of an injection. So it has been suggested, but before it would happen, we'd have a very long way to go.
Mm. Well, on that note, you have been working very hard on something called the Regional Vaccination Center, right?
Yes.
Yeah. Do you want
And
to talk about that?
I'm very pleased to tell you that 6 of our communities have gotten together. So Rockport, Essex, Manchester by the Sea, Hamilton, Wenham, and Ipswich have joined together with a proposal to have regional vaccination clinics in our area. And that was only recently submitted. And I had a conversation a couple of days ago with Department of Public Health and encouraged them to approve the application. They're still working on that. So it's very much a fluid situation, but I'm really, really pleased that the communities were able to get together and agree on how they'd like to move forward. And it's something that's really impressive because a lot of it is driven by volunteer effort, where folks in these communities are saying, we really want to make this happen. We really want to offer vaccines locally. And there have been a number of different venues identified, and I won't speak to them right now because none have been chosen yet, but a number of different locations all across Cape Ann. And the idea is that while the folks doing the vaccinations would be one team, the locations would be different and people could go to different locations as they move around. So an emphasis on convenience and an important coincidence with timing here in terms of the vaccine now eligibility being open to just about everybody. And so there's going to be much more demand, because one thing we've been seeing, Heather, at some clinics lately is open appointments because there have been a lot of folks vaccinated. And so we were starting to see more capacity than we had eligibility, but now that's changing because we have a new tranche of eligibility, which is pretty much everybody. And so we're hopeful that that's going to get approved soon. And my thanks and appreciation to folks that have been doing just a ton of work to be able to get that ready to go. And my hope is it will happen soon.
Mm. So is this, when you say it's one team moving around to the different communities, who is this team? Are these the volunteers you're referring to? Or are they?
There are volunteers. Right now, the coordination is being largely done by the Board of Health in Hamilton and by the public health nurse in Hamilton. But there have been involvement by all of the communities that I described. And the idea is that there would be folks in support of the vaccinators, and the vaccinators could wind up being paid professionals or volunteers. Everybody has to be licensed, obviously, but that decision is something that's still being worked on in terms of who's actually going to provide the vaccination. But the support staff will be largely volunteers from the communities. And this is in many ways based on a model that I worked on up in the lower Merrimack Valley, where vaccinations have been happening for quite some time. And it's really been impressive to see, in that case, 9 communities come together and really work hard to source volunteers and to make things happen. And just to give an example, they've only been running on weekends. And sometimes they're at the Page School in West Newbury, and sometimes they're at Amesbury High School. But in either place, they've been doing about 2,100 people on a weekend day, which is a huge number. And so we'd like to see those same kind of numbers locally. And again, I think the only limiting factor will be the pool of eligible folks who haven't been vaccinated yet. But there's a tremendous ability here to bring a lot of vaccination capacity to our region. And again, credit to everyone who's been involved.
Mm. And you also have a nice success story involving dyslexia screening in schools.
I am really pleased to see this come to fruition. So for a number of years, I worked on legislation which I drafted and had tremendous co-sponsorship from other members in the legislature, particularly from my former Senate colleague, Barbara L'Italian, who has a lot of expertise in special needs. She's left the Senate now, but in those days, she was very much a partner. And we worked together with an organization called Decoding Dyslexia. And we met with parents from throughout the state about the fact that dyslexia was being under-recognized in terms of being identified as a learning disability in our public schools. And I was really pleased that we got a law passed in 2018. Governor Baker signed that law into law after the legislature had approved it. And we are now seeing the guidelines get released by Department of Elementary and Secondary Education to screen every student in Massachusetts for dyslexia and other, I should say, dyslexia and some other neurological learning disabilities. And this is just so important, Heather. And I said to you off camera, this is really important to me because I have never been able to get out of my mind the thought of a student sitting in a classroom being frustrated and blaming themselves when in fact they have a learning disability and a learning challenge. And so now we're able to have routine screening standardized across the state. And it's going to be particularly focused on students who are kindergarten through third grade, because we want to try to encourage early intervention, because those interventions can be more cost effective, can be more effective, and shorten the time that that student has to sit in a classroom without an intervention. And this is incredibly important. And so DESE is issuing the guidelines. They did just issue the guidelines for the testing and for remedial steps to be taken when a student is identified as having a disability of this nature. And it's important for a whole host of reasons, but according to a recent published report, and I want to get these statistics right, between 5 and 20% of our population has a reading disability, 5 and 20%. And of those, as many as 85% are believed to have dyslexia. Mm. And so the good news here is this is something we can address. It's something that can be treated, it can be remediated, but we have to find it first. And, you know, we're always looking for learning disabilities in the classroom, and teachers are trained for that. They now, under this law, will get more training about these kinds of disabilities, but we're really sharpening our focus on some disabilities that are particularly impactful. And, you know, I was doing an interview with one of your broadcast colleagues just a little while ago with WBZ Radio in Boston, and the interviewer revealed that she had actually had this learning disability. It wasn't discovered until she was 40 years old. Oh my God. And so, you know, obviously that was something that was from the past, but we want to go forward, and we want to make sure that we diagnose this disability properly, and we act on that identification, that diagnosis as soon as possible.
You know, I have to say that my first response to this news was, this hasn't been happening so far. I mean, well, I was pretty surprised.
I understand. And part of it is, again, I don't want to mislead and suggest that our schools haven't been looking for disabilities and haven't been trying to screen. They have. But this particular disability is something that has needed more focus. And for a long time, there was a disagreement about what the definition should be of what constitutes dyslexia. And we've spent a lot of time on that, and that is now in the new regulations. And so I'm very pleased that all of this is happening. And again, it's never too late to try to do better when it comes to students that are having these kinds of challenges. And fortunately, we're doing better.
That's wonderful. Well, thank you very much for everything this week. And I hope you survive your second shot and everything goes well.
Well, thank you. I'm pleased to tell you it will be on Saturday, and it will be at a regional clinic. And I'm very pleased to be going there for that. And I appreciate your good wishes. And I look forward to being in good shape and fully vaccinated to talk to you next week.
Excellent. Great. Take care.
Thanks, Heather.